Question number 9. A 57-year-old male came with chest pain. The pain is burning in nature and is not related to meals. He gives a history of 16 kilograms weight loss over the last 6 months, and associated fatigue and decreased interest in his usual activities. His medical history is notable for long-standing gastroesophageal reflux for which he takes famotidine regularly. He has been a smoker for 20 years but quit smoking 4 years ago. Which of the following is the most appropriate next step? A. Upper gastrointestinal endoscopy. B. Testing for Helicobacter pylori infection. C. Bronchoscopy. D. Evaluation of nutritional intake by registered dietitian. The correct answer is option A, upper gastrointestinal endoscopy. The patient's presentation raises concerns about a possible underlying gastrointestinal condition, particularly in the context of his long-standing history of gastroesophageal reflux disease and smoking. The combination of symptoms, including weight loss and persistent symptoms of not responding to famotidine, warrants further evaluation to rule out serious conditions such as gastroesophageal cancer. Question number 10. A 60-year-old man presented with a history of 6 weeks of seizure episodes. Seizures are generalized tonic-clonic and associated with severe headaches. Examination shows increased tone in the left side of his body with mild hemiparesis. There is papilledema in both eyes. An emergency MRI scan shows an irregular mass in the right cerebral hemisphere. What will be the diagnosis? A. Meningioma. B. Astrocytoma. C. Glioblastoma. D. Craniopharyngioma. The best answer is option C, glioblastoma. Glioblastoma is a highly aggressive type of brain tumor, and commonly presents with seizures, headaches, and neurological deficits, due to its rapid growth and invasion of surrounding brain tissue. The irregular mass is seen on the emergency MRI scan, is consistent with the typical appearance of glioblastomas. Meningioma is a slow-growing, usually benign tumor that arises from the meninges. Astrocytoma presents differently. Craniopharyngioma is a type of brain tumor that usually arises near the pituitary gland and the hypothalamus. It typically presents with symptoms related to hormonal imbalances and visual disturbances. Question number 11. A mother came complaining that her baby was having non-bilious vomiting, and you noticed an olive-shaped mass on the epigastric region. What's the best management? Option A, pyloromyotomy. Option B, gastrojejunostomy. Option C, balloon dilatation. Option D, anastomosis. The correct answer is option A, pyloromyotomy. The clinical presentation of non-bilious vomiting, especially when accompanied by an olive-shaped mass on the epigastric region, is suggestive of infantile hypertrophic pyloric stenosis. The definitive treatment for infantile hypertrophic pyloric stenosis is a surgical procedure called pyloromyotomy. Question number 12. A 32-year-old woman came for an antenatal visit. On examination found to have a heart murmur and valvular disease. What of the following has the highest complication in her condition? A. Mitral stenosis. B. Mitral regurgitation. C. Aortic stenosis. D. Aortic regurgitation. Correct option is A. Mitral valve stenosis. Pregnancy increases blood volume and cardiac output, which can lead to pulmonary edema in individuals with mitral stenosis. This is because the narrowed mitral valve impedes the efficient flow of blood from the left atrium to the left ventricle. The added strain on the heart can result in worsening symptoms and complications, potentially leading to heart failure or arrhythmias. While the other valvular conditions listed can also pose risks during pregnancy. Mitral stenosis is particularly problematic due to the difficulty it presents in accommodating the increased demands on the heart during gestation. Question number 13. A child came with his mother to the pediatric clinic. The mother's concerned about his development. The boy said only words and he knows the colors. You reassured her is developing well. What is the age of the child in years? Option A, 2-year. Option B, 3-year. Option C, 4-year. Option D, 5-year. The answer is option B, 3 years. At around 3 years of age, children typically have a vocabulary of several hundred words and are able to express themselves using sentences with 3 or more words. The fact that the child in question is saying only words and knows the colors align well with the developmental stage of a 3-year-old. Question number 14. A 67-year-old male who is a known case of ischemic heart disease, hypertension, and diabetes mellitus, presented with a 2-day history of left iliac fossa pain, vomiting, and blood with diarrhea. X-ray shows swelling of the descending colon and edematous sigmoid colon, showing the thumbprint sign. With these findings, what is the most likely diagnosis? A. Ulcerative colitis. B. Ischemic colitis. C. Crohn's disease. D. Diverticulitis. The most likely diagnosis based on the provided clinical presentation and radiographic findings is Option B. Ischemic colitis. The thumbprint sign seen on the X-ray is a characteristic radiographic finding in ischemic colitis. It refers to the appearance of edematous mucosa with haustral markings, resembling the thumbprints of a thumb pressed into clay. This sign indicates colonic edema and thickening due to inflammation and ischemia. Given the patient's history of ischemic heart disease, hypertension, and diabetes, which are risk factors for vascular compromise. Question number 15. A 12-year-old boy going for Hajj. He didn't receive the Neisseria meningitis vaccine. His mother came to the clinic asking about meningitis prevention. What would you prescribe? A. Rifampin per os twice a day for 2 days. B. Ciprofloxacin per os twice a day for 3 days. C. Ceftriaxone intramuscular for 5 days. In this case, rifampin is a suitable choice for prophylaxis. It is administered orally twice a day for 2 days. Rifampin is effective at eradicating the bacteria from the nasopharynx, which is the site of colonization for Neisseria meningitis. Ciprofloxacin is often used in adults and may not be recommended for children due to potential side effects on growing bones. Ceftriaxone, while effective, is usually administered by intramuscular injection, and a 2-dose regimen is preferred for effective prophylaxis.